How did a microscopic virus bring the entire world to a standstill? Why did it spread so quickly? And why do debates around it still linger years later? What have we truly learned since it all began? Since the pandemic began, the world has been flooded with information, some of it true, most of it from conspiracy theories, some perhaps from confusion over vaccines and long-term effects. The coronavirus has been surrounded by more questions than answers. On this episode of Untangle, we are digging into those questions. What exactly is coronavirus? How does it spread? What do we know now that we didn't know back in 2020? And how do we separate fact from fear? Let's get to the truth behind the virus that changed the world. Don't go anywhere. We'll be right back. This is Untangle, and I am Amadine Ogbewi. Welcome back. We've been joined now by Dr. Vongdip Nankpah. He is an infectious disease physician, and that is the core area of his medical specialty, specifically at the University of Abuja Teaching Hospital, Gwagwalada. Welcome to the program.
Thank you very much.
Thanks for coming, doctor.
Thank you for having me, Amadi.
Yes, it's 5 years now.
Oh, wow,
5 years plus, actually, since those dark days, you know, when something new to the whole world at the same time happened. And I don't think anybody, or there were a lot of people who could say, I've gone through this before. The COVID-19 pandemic came. Now, 5 years later, there's still some level of confusion. So let's start with the basics. What exactly is this virus? Is it, you know, we hear coronavirus, we hear COVID-19. Are they the same thing? What is the difference?
Okay, I want to start by congratulating you for surviving a pandemic. Yeah.
Same to you, I guess that's the word.
Yeah, the last time such an event happened globally, you know, it's a lot of years ago, you know, during the Spanish flu, the days of the plague, you know, and all of that. And so, yeah, congratulations to everybody for surviving a pandemic. It's not as easy as it sounds, but, you know, congratulations for scaling through. Well, coronaviruses, because from a professional standpoint, actually, when you're talking about coronavirus, you're talking about a family of viruses. So coronaviruses refer to a particular family of viruses. They are so named because of their genomic structure. So corona comes from the Latin word that means crown. So microscopically, under electron microscope, something called an S protein of the virus it looks like a crown. Yeah, that's about the same root word you use for coronation when you are, you know, putting a crown on a monarch. So in a way, coronaviruses are like monarchs. So it refers to a class of viruses. There are about 7 of them that cause infection in humans. Among the 7, 3 of them so far, now with the SARS-CoV-2, that makes the 3rd one that has caused major outbreaks in the world. The first that has caused a major outbreak is SARS, that is the severe acute respiratory syndrome. Initially, SARS was called SARS-CoV, that is SARS coronavirus, because of the class where it comes from. But with the second version of it, or rather the second look-alike of it, so to speak, that had to be called SARS-CoV-1, so that you will call the last one that caused the pandemic SARS-CoV-2. But another virus there is the MERS virus, that is the Middle Eastern Respiratory Syndrome coronavirus, that's MERS-CoV, that caused another outbreak in 2012. So you see that people in that particular class, of course, have been known to cause very, they've been very virulent, and they've been known to cause outbreaks so far. So that's what you mean by saying coronaviruses. But we're speaking specifically with regards to what caused the global pandemic.
Yes.
you will be talking about SARS-CoV-2. That's the name of the virus. Answering your second question, whether COVID-19 is the same as, now I will not use coronavirus because now I've explained what coronaviruses are. So saying that COVID-19 is the same as SARS-CoV-2, it's not the same. One is the pathogen. SARS-CoV-2 is the name of the virus.
Okay.
Do you understand? And then COVID-19 is the name of the disease that it causes. If you observe, anytime you see the word COVID-19, it's usually in capital letters.
Yes.
That's because it's an abbreviation. It's an abbreviation for coronavirus disease 2019. That's how they carved COVID. Co is the coronavirus. No, CO, corona. V, virus, that's COVID. The last D there is disease. So coronavirus disease 2019. That's the way WHO named it to become COVID-19. So the name of the disease is COVID-19. The name of the pathogen that caused the disease is SARS-CoV-2.
And the 19 is for 2019?
Yes, the 19 is for 2019.
The pandemic that happened in 2020 began from a disease from 2019, is that it?
Of course, the virus was or rather the disease started in December 2019 in Wuhan in China. Yeah, but of course, I think specifically December 12th. So it spilled into 2020. So actually, COVID started in 2019. That's why it was named COVID-19. Yeah, so like showed in the year that's the disease started. Yeah,
it's interesting. You've already sort of explained something now that was a common idea, which is that when everyone, I mean, there's a popular video of an American rapper screaming coronavirus, and the idea was that this was a new disease, the coronavirus. But now I think it's successfully explained that it's a family of which there were previous ones. So just out of curiosity, if SARS-CoV-2 causes COVID-19, what did the others cause?
All right, so to start with, yes, the American rapper is actually right in a sense. The SARS-CoV-1 is a novel virus.
Okay.
Do you understand?
SARS-CoV-1 or CoV-2?
No, CoV-2 is a novel virus as in the way we know it now.
Okay.
Because that never existed in the human population. When SARS-CoV-1 occurred, that was also a novel virus. So before the year 2000, that family coronaviruses, we did not know about SARS-CoV-1, we did not know about MERS, we did not know about SARS-CoV-2. So everything about these last three, as I said, there are like 7 of them. The rest of them have been in existence, but they've really not caused major outbreaks. They by the way, they affect animals too. Yeah, so yes, occasionally when you see them in the human population, very mild symptoms. But these last 3, since the year 2002, when SARS-CoV-1 came to the scene, they've been really, really interesting.
Okay, maybe we should go to why this became what it became. Are there, being in the infectious disease specialty, there must be explanations for why other diseases don't, quote unquote, make a bang, and others start from a place and then spread to the whole world. How does that happen?
All right, so viruses are viruses. Let's start from there. A lot of things determine how far a particular pathogen can go. Yeah, we are looking at its ability to transmit itself from one person to another. You are looking at its pathogenicity, meaning its ability to create a disease in the person. Then you are also looking at certain characteristics of the particular pathogen. So if you're talking about viruses specifically, for example, yes, over time we know that respiratory tract viruses are prone to causing epidemics or pandemics or outbreaks.
You break down that language, respiratory.
Yeah, so I'll give examples. So for example, influenza. Yeah, so those are viruses that affect the respiratory tract. So they can affect other parts of the body, yes, but one of the major areas of the body they affect is the respiratory tract. So for example, you have influenza. So you have influenza A, you have influenza B, influenza C. Yeah, so they are, so when you have things like measles, for example, yeah, so they have, and why they have that tendency is because of their mode of transmission. Yeah, so there are different modes of transmission for infection. So for example, you have infections that are transmitted by clear contact. So you need human to human contact to get those infections. So of course, it will not travel far because you need an infected person. There's something called a transmission chain. But just a part of the transmission chain, you need an infected person to necessarily be in direct contact. By that, I mean either direct contact, contact with unbroken skin or mucous membrane or so for you to have that transmission. But these guys are airborne. That's the interesting part. They are airborne. Yeah,
which means just walking into a room, it could.
As we are speaking now, we both of us are sharing
airspace.
Yeah, exactly. As you share similar spaces with people, when one person is infected with an airborne disease, speaking gives you, okay, so there's a way we grade it. So we'll say that with speaking, you can have up to like 1,000 of it going out. With singing, you are transmitting. That aside coughing, we did not say you are coughing. I just said by speaking, by laughing, by singing, you are transmitting pathogens to the air. And you know, people share a lot of spaces. So anything that is transmitted via airborne has the tendency of actually going very far. And nothing travels faster than infectious disease. It's one of the reasons why I'm in this specialty.
Shouldn't you run away from the specialty if it's that dangerous?
No. It's, well, the outcomes are good. Yeah.
In what way?
For me, life is about solving problems. You understand? And they present a good opportunity to make a real life difference. Most of them are very acute in onset. And by outcome mean good, I mean if you treat people well, you know, they regain, they come back to full health. You don't have to drag with comorbidities. You don't have to be seeing someone for a chronic illness, hypertension, diabetes, you know, except for maybe HIV, quite a number of them are curable. So tuberculosis is curable. Malaria is curable. People who had COVID have been cured of COVID. You understand? So most of those diseases are curable. That's a very good outcome. It means that you get to meet someone once, make a good difference, and tomorrow the person is back to full health.
You know, I must say, on a personal note, I noticed persons I've seen within the infectious disease specialty, even biochemists or microbiologists, they always have this excitement about them. Now, there's this talk about how viruses can fight back, you know, they evolve. Now, during 2020, even till now, we have issues where some US officials like Fauci and co are still being said to have made spurious statements. And he said, look, this was a novel disease. Everything was happening in real time. So there were no standard practices that we could just pick and take. So that being said, what were some of those changes that happened where there was at a point, there was talk of the disease has morphed to the point where it's now more infectious, there might be other variants and so on. So take us through that process and where we are now.
Okay, so with viruses, especially RNA viruses, you are not surprised. And I will explain. By the way, coronaviruses are, you know, they are RNA viruses. The SARS-CoV-2 is a single-stranded positive sense RNA virus. The way viruses replicate, of themselves, they don't have the capacity to replicate. So they don't multiply themselves. They need the mechanism of the hosts. You understand? The way we replicate our own DNA, we store our own genetic information in a DNA. DNA is like bank, right? So you replicate that for yourself. That's how you are able to pass it to an offspring, right? But viruses need that replicative mechanism of the host so that they can multiply themselves. Now, so being RNAs, part of the, you know, replicating apparatus is to copy back whatsoever you have. It's easier for viruses that are DNA in nature, you know, to replicate themselves. But for viruses that are RNA, they are prone to a lot of mistakes when they go through that replicative processes. In fact, I've seen a literature that said that for every replicative process, for example, in a new host for the coronavirus, it has there is a 3% chance of its committing a mistake
while trying to replicate.
Or trying to replicate. Yeah, so RNA viruses are prone to that mistakes during replication. Some of the mutations, and that's what we call mutations. So they have a defect, or rather, the particular virus that infected the person is a little bit structurally different from the one the person is passing to a new person. And that's because in the process of replicating itself, because I talked about a transmission cycle, it has to infect someone, cause a disease, replicate itself, then move to the point of exit to infect another person. And so in between coming in and going out, it acquires some new material to itself. So the next person is getting some form of modification. And that's what we call a variant. Do you understand? Because of the mistakes in that replicating process.
There are mistakes.
There are mistakes. We call that mistakes, but in scientific language, that's a mutation. Yeah, because of those mutations. And in a way, it affects both people. It affects even the virus itself, because most times it's to the advantage of the virus, because some of them become more virulent. They get some other characteristics because of that mistakes, those errors. Some of them are able to evade the immune system, so they cause more severe illnesses. And some of them in a way, because of those mistakes, the way science is predictable. So the way we are able to test for a particular virus is the machine is wired to pick, if you're using PCR, for example, the probe is wired to pick particular points in the viral genome to identify. You understand? Every virus, or so all of us have a thumbprint, right? And your thumbprint should identify you. So in a way, in that genetic material, every virus has its own thumbprint. So you are using the machine to detect that particular print to tell you that this is the virus you are dealing with. Now, if you have a mistake or that mutation in that particular place of detection, that machine will not be able to detect that virus. So in a way, they evade even diagnosis. Yeah, so WHO, CDC will tell you that there are 3 forms of variants. So you have a variant of concern, you have a variant of high consequences, you have a variant of interest. So a variant of interest is the first one I've explained, that has the tendency or capacity to, because of its mutation, it can evade the immune system. It can even, find a way of not being detected by the regular diagnostic, modality. So we have to now recalibrate, or we have to now redo the way we diagnose the same thing. So you now get a new probe, or you add that particular component to your testing mechanism in order to make that diagnosis. But COVID is a...
So you're adapting with the virus as well?
Of course, you have to, because you cannot, if you cannot trace someone, you cannot beat it at its own game. So in a way, it's modifying itself to dodge you, and you have to. People will say if the birds learn how to fly without perching, of course the hunters must learn how to hunt without. Yeah. So in a way, so COVID, it's under. I think COVID, the variants in COVID are more variants of concern, because their own modification just had worsening of symptoms. For example, there are different variants, by the way. You have the alpha, the beta, the delta, the omicron. The last of that variant that made a lot of waves is the omicron. Yeah, so of course, because of what I've just explained, it caused more severe illnesses and more deaths later. Not more deaths, so to speak. Over time, you expect that a particular population will develop some form of antibody response. So in a way, your body is now waking up to respond to that presence. And because of those antibodies, people who now get infected get a milder course of the disease.
All right.
Yeah. So.
All right. So let's round off this segment now by talking about the state of things now.
Yeah.
There are 2 words that get thrown around a lot: pandemic, endemic. What's happening? Because people feel that COVID thing, that was a scam. Nothing happened. I don't know anybody who died. Nothing is happening. I mean, now they say there's no problem. The scam is over. So what happened at that time where borders were closed, lockdown happened, and now it is still said to be, it's a disease, but then there's a new category for it. What changed and what caused that category?
Oh, good. All right, so let me pick up from the last thing I was saying with regards to antibodies. You know, when you introduce a new pathogen to a population that has never been affected by that pathogen ab initio. So in the first place, this particular population has never been introduced to this particular pathogen. It will produce a lot of chaos. Our bodies have a memory of, you know, the infections you've had in the past, and why you need that memory so that when it's coming again, it is better prepared. You understand? So initially, SARS-CoV-2 has never been in anywhere, no human exposure. So when it started, it was making a lot of waves, causing a lot of sicknesses, and standard precautions and transmission-based precautions resulted in all of those social distancing, mask, use of hand hygiene, closure of borders so that you limit travels, you know, and all of that. But now, having been exposed to the population, a number of people now have some level of immunity, either via natural infection or via the vaccine. So it's no longer as dreaded as it used to be. This is not to say that the SARS-CoV-2 virus has gone. No, if you check the WHO website as of today, you are going to see the number of cases that they are still diagnosing and they are reporting worldwide. But you don't have that number of deaths because of the immunity that we already have. Think about it this way. We're born and raised in Nigeria. If you do get malaria, you can recover from it. I know of someone who came born and brought up in the US, had malaria. The people here thought, oh, it's the same malaria we've been having. So they gave her ACT tablets and she died. Yeah, so we have some form of antibodies that in a way protect us from severe forms of the disease. And, you know, so because of that, you have some immunity. It doesn't mean that you will not come down with it, but it wouldn't affect you the same way to affect someone who has never been exposed to this. So that's basically what happened 2019, 2020, 2021, and what's happening now. Now we have some form of immunity globally because of, you know, either through the vaccine or by natural immunity. And that's why all of those precautions, you know, were relaxed and all of that. So that's about what happened.
All right. Just hold that thought. I have a quick follow-up. We'll go on a break now. When we return, we'll delve into it. Don't go anywhere.
Culture connects us beyond borders. It's a bridge between traditions, creativity, and the future.
Culture is alive, shaping identities and communities every day.
Art tells stories of resilience and vision.
Artists blend tradition with innovation.
Cultural preservation creates sustainability and empowerment.
Culture evolves and adapts.
Music and dance unites communities through movement.
And right here, in the heart of our cities, artists and creators are keeping these cultures alive.
On Culture Cove, let's explore,
celebrate, and preserve the arts and culture that define us. All right, welcome back. We're still talking about coronavirus here with Dr. Vongdip. So let's quickly, I mentioned some terms, endemic, pandemic. What is coronavirus classified as now, COVID-19, and why?
Okay, so, well, by now, it's all right. So, Pandemic means that when you have a pathogen that has affected more than one continent, that's what you classify it as being a pandemic. So epidemics, okay, so that's why I like using the word outbreak, so that I'm not very technical with those terms. Epidemic is when you are having a new pathogen, involving more than one geographical region. So it is outbreak, especially if it is happening for the first time in that geographical area, or it's happening above the normal threshold per year. So you can still have epidemics of like maybe Lassa fever or something, cholera epidemics, or cholera outbreaks and all of that. So for now, SARS-CoV-2 has caused a pandemic. You understand? So it's a pathogen that has caused a pandemic. It's a pathogen that has crossed international borders. So that's why it's categorized as a pandemic pathogen. So.
All right. So let's talk now about vaccines. I think one of the biggest concerns people had was that they hear of a lot of diseases still not having vaccines or being vaccine preventive. And they said in the space of, was it a few months or thereabouts, we heard about a year or so, we heard about this disease. It's new, it's novel, and now it has a vaccine. How?
Good question. Actually, the truth is, the efforts towards getting SARS-CoV-2 vaccine did not start in the year 2020. Interesting. A lot of what was used as the backbone to develop the SARS-CoV-2 virus actually started with the SARS-CoV-1 virus. So after 2003, after the SARS-CoV-1, the thoughts towards a vaccine started. In fact, around 2007, 2008, there was a phase 1 clinical trial for SARS-CoV-1 vaccine. More knowledge and understanding for the coronaviruses was added after the MERS outbreak. Do you understand? So it's not as if we just woke up and started thinking and started creating a vaccine in 2020. No. Already there have been some work done within the coronavirus families, and there have been successes. You understand? It's just that because of the loads of those data that were already available, it was a little bit easier to close down to get a vaccine for SARS-CoV-2 within 1 year. It's not as if the entire initiative and thought started between that. No. We had known about the coronavirus families, and efforts and a lot of academic work and researches had already been ongoing to develop vaccine for that class of diseases. You understand? So it's not as if it was something that started from the scratch. If you think about it that way, it will now make sense why we had that vaccine. So imagine from 2003 to 2020. That's how many years? Indeed.
So what would you say are some of the biggest misconceptions about coronavirus today?
As you said, the first thing I heard is a scam. Some people attached it to mark of the beast. Some other people said it was 5G. I've heard many things. Some other people said it is a strategy to reduce world population. I don't know how you connect those logics, but really, I stick with the sciences.
And did the sciences disprove those assertions?
Of course. I mean, you don't even need the sciences to disprove some of those things. For example, talking about COVID being connected to 5G. Think about it. Radio waves is what you have. I mean, basic physics. We understand that if you are talking about mobile networks, right, you're talking about radio waves. What's the connection with that with a virus that you know the genomic structure? Again, there are countries that did not have 5G, but yet they had SARS-CoV-2. So how do you explain that? As at that time, 5G network was not even a thing in Nigeria, not as we have it now. So how do you explain that?
So what about some, the basic things like symptoms, effects, and all of that, and how people should move or behave now in 2025? I say this because for every other disease, when you hear about malaria, get rid of stagnant water, use mosquito nets. These are the precautions. It exists for multiple diseases. When it's about STIs, to stay away from unprotected stuff and all of that. But for COVID-19, people say, well, people didn't really die. Is it even something I need to take precautions for? So that's the question. How fatal is it? And in this time, as long as it still exists, and you've even mentioned that cases are being reported, what should people do?
Okay, good. The same precautions we take for respiratory tract illnesses, cough etiquette, hand hygiene, those standard precautions, it applies to COVID. It's not as, I don't want to say it's not as fatal, but it's not, the case is not now, the 2015 type of COVID is not as bad as it was in 2020.
15?
Sorry, 2025 now,
Okay.
I mean to say. COVID is not as bad as the 2020. That's, again, as I explained, because at least now we have some immunity. But what is of concern right now and of public health importance is something called long COVID. That's where the conversation is going to. Because apart from now, as I said, some people still have severe illnesses because of either comorbidities, the issue of age and all of that. But now we are beginning to have something called long COVID or post-COVID conditions, which I think is something of public health importance.
So what is that?
Yeah, so long COVID is refers to a set of symptoms, really, that are noticed or are found in people who initially, when the idea came, they were thinking maybe you needed a time frame of like developing those symptoms like 3 months after being infected with SARS-CoV-2, and they should have persisted for like 2 months without any other explanation to say it's long COVID. But now the definition, CDC has even modified it to say that it can also occur early. So we're talking about symptoms that occur in people who have had SARS-CoV-2, which can last up to like 3 months or more, right? Without any other explanation. And it's for now, it's not predictable. A lot of studies are going into it. Unfortunately, I don't know any that is going on in Nigeria. We need to contact people who have had COVID before, and especially people who have had severe symptoms that, warranted hospitalization, ICU admissions, and all of that, to know if they develop any of those features, those clinical features, talking about fatigue, especially with activities that is limiting the next activity. So we're talking about memory problems. Some people have had neurocognitive issues. Some people have had sleeping problem. Some people have had some, chest pain, difficulty in breathing. So the symptoms are, some people have had depression, anxiety, and nothing can explain it apart from the fact that they've had severe forms of SARS-CoV-2 in the past. As I said, for me, I think if you've had severe forms of SARS-CoV-2 in the past, and you're experiencing any of this, please just contact your physician to be sure what you are dealing with is not long COVID. And so right now, that's like the problem of public health importance from COVID. Yeah. So, and I think everybody should know, and especially if you know anyone who has had to suffer that in the past or is currently suffering. The thing is, some of them can resolve. Some of them persist. And as I said, a lot is yet to be known. So we cannot even predict whose can persist, whose own will resolve. But what we do know is that people who were vaccinated after they had COVID are less likely to develop long COVID. So people who have not been vaccinated who develop COVID, one. Secondly, people who have had severe forms of COVID in the past. People who have had comorbidities, elderly people are the people so far at risk of developing post-COVID conditions, or what we call long COVID.
All right, fair enough. That really broke it down. Though one of the answers before might have caused concerns for some people, because I believe a lot of people thought getting the vaccine was like this, and they do hope that if there are outbreaks in the future of any kind, there will always be work on ground to get that vaccine pronto and to protect everyone. But that being said, let's end the matter on this note. The pandemic came. I don't know if it's right, if it's technical to say and has gone, but the pandemic was, hit hard, and then there's a period now of recovery and even growth in some places. Yeah. What are your assessment of the things that happened and where we are and how we can respond to these things if it should come up again?
Well, if I'm going to answer this within the context of emergency preparedness for outbreaks in Nigeria, I'm not sure we've learned a lot from COVID, because I expect that now we should better be prepared in terms of surveillance, in terms of diagnosis, in terms of case management and all. I'm not sure or maybe we have short memory or something. Yeah, but this can be proven if you consider outbreaks that happened after COVID. I mean, how many cholera outbreaks have happened in Lagos State, for goodness sake? We're still battling with outbreaks of Lassa fever. You know, the trend this year had changed, unlike the trend we used to see in the years in the past. I was expecting that we should be better at managing these outbreaks now, since COVID had put some things in place. You know, where are all of the molecular laboratories that we have in different parts of the country? They've been closed down. Grasses are growing in those facilities now, and all of that. And so, what is the level of preparedness now? What is so all of the IPC, that's the infection prevention control practices we had at that time, where are they now? You know, we still have other hospital-acquired infections that are still ongoing. So because COVID went, did not mean that our IPC standards should have gone down or something. Yeah, so if you are considering in terms of all of those things, in terms of either public health, surveillance, diagnosis, you know, I don't think we maintained that preparedness. It's not totally a hopeless situation, because we had a structure on ground. It's just to work on it and be better prepared. Globally, yes, some changes had happened in some countries. Even the WHO had to form a new organ, you know, for outbreak preparedness and all of that. Our very own Dr. Chike, he was the head of NCDC, had moved to that because of the way he responded to COVID in Nigeria. So yes, globally, a lot of things have changed. A lot of research, a lot of grants. In fact, what we do know about COVID now is because of some of the researches and the grants that it went to and all of that. Some countries are better prepared now to face emergency outbreaks and all of that. But again, as I said, globally, yes, you can say that something has changed. Locally, West African sub-region in Nigeria, it's yet to be seen.
I guess we have to still work on that as we move forward. Thank you so much for coming.
Thank you very much,
Doctor, and for breaking it down for us.
Thank you very much.
All right, there you have it. We have successfully untangled coronavirus. I do hope you've learned a thing or two, and you understand better now what the disease entails. COVID-19 specifically, even if you didn't know before, COVID-19 is the disease caused coronavirus, is the family of viruses. So that's how we round off this time. Do join us once again right here on Untangle, where we break down issues for simple understanding and we debunk misconceptions about popular, trending, or complex topics. See you next time. Bye for now. I am Amadine Uberi.